Hello, everyone from St. John's, Newfoundland and Labrador. My name is Andrea Worman, and I'm an Alumni Engagement Officer at MUNalum and your host for today's event. I'm here with Dr. Veronica Hutchings, Associate Professor and Director of the Aging Research Center, Newfoundland and Labrador at Memorial University. I know those of you attending can't see who else is in the room, but we have a full house. There was over 530 registrants, and as I'm watching the participants click up here now, we are at 230 and more joining every second, so we're delighted about that. We will begin today's event with the land acknowledgement. We acknowledge that the lands on which Memorial University's campuses are situated are in the traditional territories of diverse Indigenous groups, and we acknowledge with respect the histories and cultures of the Beothuk, Mi'kmaq, Innu, and Inuit of this province. We encourage everyone to reflect on these lands from where you are located and the Indigenous peoples for whom these lands are traditional territories. At the Office of Alumni Engagement, we're focused on offering many ways for you to connect with Memorial from anywhere in the world. We are working diligently to create opportunities to celebrate, socialize, mentor, learn, and advance both your career and improve your life. MUNalum 101 was born out of the need to reach alumni during the first few months of the pandemic. It has since evolved to become a cornerstone of the alumni engagement activities, offering the latest information on key topics from Memorial University's own experts. Embarking on new and exciting ways to build relationships with our Memorial family of over 100,000 members is vital to our evolution as an institution. Alumni are the drivers of economic, social, and cultural development across the province and beyond. So please consider getting involved with our programming. You can be a mentor with 10,000 coffees, discover opportunities to meet up with expats through Global NL, join our online book club, Coastlines, featuring a stellar selection of Newfoundland and Labrador authors. And you can find out more details on our website, www.mun.ca/alumni. So thank you for joining us today for our discussion about living with dementia. Just a few housekeeping items before we get started. A brief Q&A will follow the presentation, so I will be monitoring the Q&A function, which you will find at the bottom right-hand side of your screen. So please try to keep your questions short, and I encourage you to post your questions as soon as possible. Don't leave them till the last minute, as we have a very full program and we will have limited time to take questions. You are not able to unmute your microphone or turn on your video, and you won't be able to see other people's messages in the chat. We are streaming live, but this session is being recorded, and you will receive a link to the recording and a follow-up email. So it is my great pleasure to officially introduce our special guest today. Dr. Veronica Hutchings completed her PhD in clinical psychology at the University of Regina, where she focused her clinical training on assessment and treatment of persons with dementia and their families. She spent a decade working at the QE2 Health Sciences Center in Halifax, and the last 5 years of which she worked exclusively with older adults and closely with Alzheimer's Society of Nova Scotia, running groups for persons with dementia and their care partners. She moved to her hometown of Corner Brook with her family in 2015 and was appointed the inaugural director of the Aging Research Center, Newfoundland and Labrador, when it was launched in 2018. So I will now turn the presentation over to Dr. Hutchings. I will turn off my camera and see you in a little while. Thank you.
Thanks so much, Andrea. I'm going to try to share my slides now. Hopefully it will work. And there we go. Great. And so I'm so excited that you are all here with me today to talk about living well with dementia. And I'm really excited about this because today, February 1st, is actually the first day of Psychology Month in Canada. And as a psychologist, I think that's really great when we are able to get together and talk about things. It's unfortunate. I'd love to be doing this in person with you, but I don't think we'd be able to get as many people in here in the one room. So, excuse me, basically what I want to do today, there's kind of 3 things that I want to do. I want to talk about what age-related changes are expected. And I also want to talk about what dementia is, because a lot of times people can confuse what is normal age-related changes for dementia. I'm also going to bring up 3 myths that I hear or have heard quite often from people, and I want to give you the truths that are kind of corresponding to that. And then throughout that, I'll be giving you tips for living well with dementia, because this presentation, it really is meant for persons who are living with cognitive decline, as well as their family and friends. So I will try to make sure I remember to speak nice and slow and to be as clear as I can when I'm speaking. All right. So what are the expected age-related changes? Well, we all know that our bodies change as we get older, right? So we get gray hair, we have wrinkles, shrink. Uh, our brain changes too, right? Both in terms of its structure as well as its function. So some of the ways that our brain can change as we get older is that it becomes more difficult to concentrate. So focus or pay attention. Multitasking, trying to do multiple things at once, even though actually as human beings, we're really not that great at it, we do actually get worse as we get older. It's harder to switch back and forth between 2 different tasks. Word finding. So that tip of the tongue phenomenon where, you're trying to find a word and you just, you want to say something, but you just can't find the word, that happens more often as we get older. As well as it's harder to keep information in your mind. So when you're thinking about something, you're going along and you're trying to hold some information, whether it's, just a phone number that you've just looked up, or if you're speaking with a family member or a friend, and you have a point in your mind that you want to say, you might lose that more easily as you get older. Yeah. So, well, people say, well, no, that's not, well, what does that mean? And if I have dementia, so if all of this is normal, what is dementia? Or if that's all to be expected, what is dementia? Personally, I think normal is a setting on a dryer, and it shouldn't be a word that we use when we're talking about people. So dementia is a neurodegenerative condition. So neuro refers to neurons. So those are the technical or medical term for our brain cells. And degenerative refers to, the loss of that brain cell in terms of both the brain tissue as well as the function. So dementias are diseases, the term dementia refers to diseases that are marked by declines in memory, so our ability to recall information, what we had, what we did last week, language, so our ability to find our words, use our words, put them together properly, problem solving, as well as other thinking skills, right? So, and it will really depend on what part of the brain is being affected, right? Lots of people will say, well, what's the difference between Alzheimer's disease and dementia? Dementia is an umbrella term, and it's used to refer to many different types, right? So Alzheimer's disease is the most common. An easy analogy is to think of, cancer. Cancer is a very broad term, and it can refer to, you can say, I have cancer, and it's, it might be skin cancer, it could be lung cancer, it could be breast cancer, or you can be more specific and actually say, I have breast cancer, or I have prostate cancer. And that's where, Alzheimer's disease, vascular disease, Lewy body disease, frontal temporal dementia, those are all the different types. So that's like, the specific types. So you can say that you have dementia using that broad term, or if you may have a more specific term. Right? And so this, just in terms of the various parts of the brain, here, wherever those changes that we see in the brain, so for Alzheimer's disease, for example, we see atrophy, and it begins, I'm not sure if you guys are able to see my marker here, pointer options. Let's see, the laser pointer right here, this temporal lobe. So this is the part of the brain that is responsible for language and our memory. And this is also the part of the brain for Alzheimer's disease that where we start to see changes first, where we start to see that shrinkage. So the brain cells, we actually start to lose the brain cells in this area. That's why word finding difficulty and memory loss are some of the first symptoms of Alzheimer's disease. your frontal lobes. So this is where our filter lives. So, when we think of things that are our inside voice, so if somebody is wearing a truly an outfit that we find very ugly, but we know not to say that out loud. That's because of our frontal lobes helps us to make that decision and say that's not appropriate. So when the frontal lobe if that becomes affected, we start to have some of those types of symptoms. So for example, in a frontal dementia, you see some, even though the person may have no trouble remembering things because their temporal lobes aren't affected, but they may be displaying inappropriate, odd, strange behavior. And again, that's from those frontal lobes. Let's see, is this going to let me go? Let's go to next slide. So this here is actually a CT scan of a woman with Christine Bryden, who's actually an author. She actually wrote and published 2 books after being diagnosed with dementia, and an age-matched control. So you can see here with the ventricles of the brain, and you can see along here for older adults, there is more space than we would expect to see in somebody who's younger, but you can see over here, there's a lot less brain cells. So these are when we're talking about the changes that happen, why we can't do certain things, it's because our brains are actually changing. So given all that, what are some of these myths that we're seeing and out there? So first one, I'm going to see if I can get rid of that pointer and see if it'll let me click. First, excellent. So the first one is that once you have a diagnosis of dementia, you are incompetent. Wrong. Right? In the early stages of dementia, so even once you've been diagnosed, most individuals retain competency. So that's a global ability to understand and appreciate information. So even though you may have been diagnosed with, or maybe you haven't received a diagnosis yet, maybe you're just noticing that you are struggling with your ability to think and remember things, and you're working with your doctor. That doesn't mean that you're incompetent, right? So if you do have dementia, though, if you have been diagnosed, my living well tip right now is to start to talk and plan for your future now, right? So do you have an advanced healthcare directive? Do you have an enduring power of attorney? Do you have a will? Have you thought about any of these things? Now, a lot of people say, oh my God, Veronica, what are you talking about? Like, this is really depressing. Like, why you want us to think about dying? Well, hopefully everybody knows here, life is a terminal condition. We are all going to die. The great thing about, knowing and we have dementia and getting it caught in or diagnosed in those early stages is that you can start having conversations now and make plans for how you want the rest of your life to go. So, with an advanced healthcare directive, that's something you could discuss with your family doctor in terms of what are the options, what are the treatments that you want as you get older, because just because you have dementia doesn't mean you're not going to have a heart attack or that you might not have some other health complication. So you want to be able to explain that right now, because as the disease progresses, and you get to those later and the more moderate to severe stages, it will be more challenging for you to be able to clearly articulate what it is you want for your health care and what you want to happen with your belongings and all that stuff. So having these conversations now, it's really, really important. I know they can be really hard and they can be difficult to start talking, but we're all going to die. And so let's plan for it, let's talk about it. And so that way we can just put it away to the side and focus on living to our best lives that we can. The second myth is life is over with a diagnosis of dementia. I just said we want to get all that future planning out of the way so that we can live our best lives, right? Yes, some people, you can choose to live as if your life is over, if you've been given a diagnosis of dementia, but you can also live vibrant lives with dementia. Remember that people have written and published books after being diagnosed. That CT scan I showed you of Christine Bryden. And if you go online, you can Google her and you can actually find her books that she has written. Again, after she's lived. So there's so many things that you can do, right? Now, you may struggle with it a little bit, so it can really help if you tell others about what's going on. And so that's my second living well tip, right? Now, that said, I'm not here to force you to tell anybody that you don't want to. I don't think you should tell anybody that you don't want to. And you are the best judge in terms of who is in your family circle, who's in your friend circle, your tight 10 that we have right now in Newfoundland with our COVID restrictions. However, the benefit of telling people what's going on with you means that those who are close to you, they can help support you, right? And it might be something as simple as, I was diagnosed with Alzheimer's disease, but I'm managing very well. Or I've been diagnosed with a condition that affects my memory, but I'm doing well. I'm coping okay. Just wanted you to know, right? So if that thought of telling people is overwhelming, plan ahead for that conversation. Give yourself some time. What is it that you really want to share? And with whom do you want to share it, right? So you may give more information and more detailed personal health information to, say, your partner or your children, siblings who are people who are very close that you see, on a daily basis. Or you may not want to, maybe you want to keep some of that information private. You only want to kind of give the bare minimum details, right? In which case you might want to start with saying something along the lines of, I don't want to get into the details, but I wanted you to know that, and you tell them whatever it is you want them to know, right? Sometimes it can help to offer to talk now or later, but it's really important to be honest. I think there's lots of times people can be embarrassed about it, but there's nothing, it's no more embarrassing than developing any other medical condition. Yes, it can be frustrating, but I think, rather than saying, oh no, I'm just getting older, no, it's not just getting older. Yes, things change. Our cognitive functioning, our ability to think does change as we get older. But if you've been diagnosed with dementia, that's not what that is not what's happening. There's a disease process here. And so you want to be mindful of that and be honest and be respectful of that, right? It's also helpful to keep in mind that others have the right to react whatever way that they need or want to, right? So just like you probably had a reaction when you were told of your diagnosis, and maybe it was expected in the sense that, like, that you've seen it, you've known other people who have lived with dementia, and you saw the signs, you've been kind of working with your physician and kind of going through that diagnosis of exclusion, because there isn't a blood test or an x-ray or anything that you can do that will say, aha, yes, boom, this person definitely has a dementia. It's a diagnosis of exclusion. So they have to rule out all the other conditions that might be causing your symptoms. And sometimes that can take a while. And if it does, so then sometimes you're kind of preparing for that. Other times it's a shock. And so you may be very surprised. So the same may be true of your family members and friends. They may be expecting, they may have been suspecting it. If you've had symptoms for a while, they may be also taken by shock. They might be sad, they could be angry. You know, that's the neat thing about human beings, is that we have all of these emotions and we're entitled to those emotional reactions. There's nothing wrong about them. It's just part of the human experience. The third myth that I wanted to bring up is that people with dementia cannot understand what is going on around them. Again, Now, it is true that people with dementia may have difficulty understanding when people talk quickly. So this is the stuff that, I love talking about dementia, particularly with people who are living the experience of dementia. It's something that it's how I was drawn actually into psychology, was my fascination. As from years ago, volunteering at a seniors home where I was working with folks with dementia. But if you couldn't understand when people are talking, why would I be having this talk? Wouldn't make sense. And why would I have spent all those years kind of focusing my education in terms of working with persons with dementia? Wouldn't make sense. But if I speak quickly, which I do have a tendency to do, so I'm trying to be very mindful of that and remind myself to speak slowly. Or when there's many people talking at once, it can be harder to tease apart those different voices, harder to follow multiple conversations. Um, you know, Likewise, if the person is tired or feeling unwell, even myself, I know if I'm not feeling well, it's harder to, you know, pay attention in a meeting if you haven't slept well the night before, or if you're feeling kind of sick or run down, you just don't have the energy with it, right? It's the same thing. So being mindful of all that, it's, if people are talking quickly, lots of people are talking at once, if you're feeling unwell, yeah, you're going to have more trouble understanding. But as I said, you can follow conversations, particularly when the people that you're speaking with are aware of the fact that you have dementia. So it's helpful to, could you please speak slowly, or speak more slowly? I'm having trouble following you. Or I have a medical condition that makes it harder for me to follow, to understand when people speak quickly, right? But the more you talk to people and kind of explain and ask for help, the more vibrant, the more fulfilling your life can be. So, given that, you say, okay, but, so we've talked about talking about it, the condition, we've talked about planning, but what about right now? What exactly do I do? I have these symptoms. How do I manage them? Well, in terms of, it really depends on the symptom. Right? So, do you have memory changes? If so, develop a routine of using reminders. The great thing about human beings is we are creatures of habit. And so we can use that to our benefit. If you get in the habit of whenever you get a phone call or you make an appointment, you write it down on a calendar and fall into a habit of checking that calendar multiple times a day, that's going to help you, because then you don't have to remember to check the calendar. You don't have to remember that you have a doctor's appointment at 2 o'clock, because it's just a routine. You just go, you check, you see it's what's on the calendar for that day or that afternoon, and you follow through with it, right? What about changes in your day-to-day abilities, right? Well, change what or how you do things. So let's say, maybe you like to play golf and you used to walk 18 holes, but now you're finding it's just too tiring, it's too fatiguing. Can you do 9 holes? Can you use a golf cart, right? Maybe you used to love to do jigsaw puzzles, and we have 5,000 piece, really complex, really difficult jigsaw puzzles. Well, what about trying a 1,000 piece? What about trying a 500 piece? Um, there's all different ways. So, and you can say, well, I don't want to do that. And fair enough. I understand it's not always easy to make those changes, but when you recognize that, this is, you have this medical condition and it's affecting these things, you can choose to just say, okay, well, I can't do it exactly the way I used to, the way I want it to, or, you know what, I still enjoy this activity. So how can I tweak it? How can I still get some enjoyment from it? Or maybe, maybe it's that you need to try something new. So maybe activities in the past, maybe before you loved to read and you loved the feel of picking up a book. But now maybe you're really struggling with being able to read books. So, and you hated audiobooks. Maybe it's time to try an audiobook for a change and follow that. Or maybe you loved audiobooks, but now it's time to try paperback. Try something different. Whatever it is that you enjoy, is there something else that might be similar, but maybe a little bit different that's not going to be as demanding on your brain in a way that used to. So can you find an activity that's going to be a little bit kinder, a little bit gentler to your brain than the previous activity that you really enjoyed? Because we can still get pleasure out of those things, right? Changes in your ability to talk to others, right? Again, so there's lots of ways to handle this. Instead of having big groups, do more one-on-one. That large family gathering might not be enjoyable anymore for you. So maybe instead you have multiple smaller family meals where you just invite, instead of all your kids, you just invite them over one at a time and have, smaller. Instead of cooking a 12-course meal, you just cook a 3-course meal. Listen, I actually was working with a client who, and he was, we were welcoming a new member into our group. And this new woman, her diagnosis was primary progressive aphasia, which is a type of dementia which is characterized by severe difficulty speaking. So she really had a hard time finding her words and being able to speak. And he said, and he asked her a question and she was struggling. He said, you know what I do when somebody asks me a question and I can't find the words to answer it? She shook her head. And he said, I ask them the question back. He said, because today everybody is so, focused, self-obsessed, that nobody gets the opportunity to talk about themselves. Hardly anybody asks anybody anymore what they're doing or how they're feeling and really listens. So he said, if you just ask the question back to the person, they'll start talking and going on, and you don't have to worry about trying to answer it. He said, but don't try it with the physicians. They won't let you, the doctors, they won't let you get away with it. And I thought, this is brilliant. He has found a way to kind of navigate that symptom. So instead of having an awkward conversation, when somebody would ask him the question and he was struggling to find the words to answer it appropriately, he didn't want to lie and just make up something with words that he could find. He just spit the question right back at the person. And it worked really well in social circles. Of course, when you're doing, if you're seeing your physician and they're assessing how your brain is functioning, yeah, they're probably not going to let you get away with changing the subject that way. But I thought that was brilliant problem solving on his part. Right? And also, find activities that don't rely on talking if that's trouble. So maybe it's, watching movies together, maybe it's sitting down and, crocheting together or knitting together or doing some type of physical activity or even just sitting and holding hands, right? Painting, there are lots of different activities that you don't necessarily need to use your words. So if you're really struggling with finding your words, look for activities that don't rely on talking, right? Um, oh, one other thing I should mention about your memory changers and developing the use of routines. I mentioned, writing things down for, appointments and whatnot. When it comes to doing things around the house, though, you can set alarms and that can be really helpful. But if you're setting the alarm on your, the timer on your microwave, for example, for everything, pretty soon it's just going to be a reminder that you've forgotten something. So if you can, try to pair the reminder with the activity if you can link it to. So if you noted that you will often start laundry and then you forget that you've done the laundry, and then until a couple of days later you come back and you find the wet laundry in the washing machine and it's smelling and needs to be washed again, go to the dollar store and buy a cheap timer and put it in, a cheap but loud timer alarm that you set up in the laundry room, so that when you put in the washing clothes in the washer, you can set it so that when the alarm goes off, it signals you to go back to that laundry room, so that then you have the cues that, oh yeah, I'm in the laundry room. What is it I'm supposed to be doing here? Oh, right, it's the laundry, right? Using kitchen, timers on stoves and microwaves and whatnot are great for activities that rely on cooking, or that you're doing in the kitchen. So if you can tie it that way, if there's some way you can make the reminder tie into the activity that you're trying to remember to do, that can be really helpful. Overall, in terms of keeping, remembering your overall health and wellness. So, what's good for your heart, that's good for your brain, right? And a lot of people, there's been a lot of education out there around heart disease and the things that we need to do to keep our hearts nice and healthy and strong, right? So, for example, we know that exercise, right? And eating healthy foods, not too much salt, not too much fat, all of those things, they are going to reduce the risk of other health problems. So, well, yeah, it's not great if you've been diagnosed with dementia. If you have dementia as well as, cardiovascular disease, that's going to put you at risk for having, many strokes and other complications. So we want you to be as healthy as possible, right? And we know that exercise will slow that down, right? It will slow down the rate of the decline in dementia. So the more that you can keep your body moving, the more that you can make good food choices, the better off you'll be, and the easier it will be for your brain to be able to function at its peak ability that it can. Right? Drink lots of water. A lot of people don't realize how dehydration can worsen your symptoms, right? So even just, a dehydration headache. So often people will have a headache, um, and I'll ask them, well, when was the last time you had anything to drink? It's like, oh yeah, I had a cup of coffee. I just had a cup of coffee. I've had like 8 cups of coffee today. Well, it's great, so yeah, but you may be wide awake with caffeine, but that's a diuretic that's going to actually make you pee, and it's not necessarily replenishing the fluids in your body. Our bodies are made up of a lot of water, and if our bodies are getting dehydrated, it's going to be harder for our bodies to do the things that it needs to do. So, drinking lots of water so that you have the lubrication and that you have the fluids in your body so that it can operate the best it can. Another really important thing, and this can be sometimes intimidating for individuals, is talking to your physician, talking to your doctor about reviewing your medications. A lot of times people say, well, I don't need to talk about my medications. I've been on the same medication, the same dosage for 20, 30, 40 years, and it's never caused me any problems. Yeah, you're right. But 20, 30, 40 years ago, you were 20, 30, 40 years younger, and your kidneys were 20, 30, 40 years younger, and your liver was 20 or 30 or 40 years younger, right? And so as we get older, those kidneys and our liver, our body's ability to metabolize and process those medications reduces. So as a result, even though you may still be taking the same medication in the same dosage, you might actually be having a higher level of the medication maybe staying in your body, right? And so sometimes, again, when you're looking at that risk benefit, there are some medications that we know are prone to cause complications in seniors. Um, and so if the website safermedsnl.ca has a lot of great information about deprescribing, which is a movement that a lot of that a lot of physicians and pharmacists, not only in Canada but worldwide, are working on in terms of helping to reduce the inappropriate use of all types of medications. Because again, with medications, the more you take, the more chances there are of an interaction or a complication, and then it's harder to figure out exactly what's going on. So obviously, if you need a medication, you want to be taking it, but it doesn't hurt, to go in and, the next time you go make an appointment with your physician, or you have an appointment with your physician, or actually, you know what, go make an appointment specifically to talk about this and say, you know what, I heard about this movement, Safer Meds NL, and I'd like to talk to you about my medications. Do I need to be taking all of these medications? Do I need to be taking all of these? Are they the right doses for me? Can I, start to come off of some of these? Um, because again, it's best if we are able to have the least amount of medications at the lowest dose in our bodies so that we can minimize the chances of complications. So, in summary, dementia is a term, an overall term, that refers to diseases which affect our thinking. So these are progressive diseases. So over time, we have more and more trouble with the ability to think, remember, find our words, problem solve, all of those things. There are a number of myths out there about dementia. So just because somebody says something about dementia, you really want to think about where is this source? Where is this coming from? Is this just Joe Q Public sharing something on Facebook? Or is this actually coming from your physician? Or is it coming from the Alzheimer's Society of Newfoundland, Labrador, or Canada? Is it a reputable source? Does this person actually know what they're talking about? Can you trust that information, right? Because you don't want to be holding on to untruths and believing that you are not capable of doing the things that you actually are capable of doing in spite of having a diagnosis of dementia. By planning for your future now, right? So have those hard conversations, get them out of the way. Talk about the Advanced Healthcare Directive. Talk about, the enduring power of attorney. And that's important, the enduring piece, because the enduring means that it will still be in effect when the dementia progresses to those severe stages when you are no longer competent, right? So you want to be able to make sure that the people that you're trusting your affairs with have the authority to do what you want them to do, right? Take care of the planning for the future now, put it out of the way. Take care of your health now, drink water, exercise, eat right, those fruits and veggies, which I know are really hard to do in Newfoundland in February, but, do the best we can, right? Talk to your friends and family and find strategies to manage the symptoms so that you can live well with dementia, because it really is possible to do that. So thank you so much. This is a talk that I could go on and on and on forever about talking about this, but I wanted to make sure that we have lots of time for questions. And I also want to let you know that, if you do want to, if you're interested in aging, if you're interested in dementia, please feel free to reach out to the Aging Research Centre of Newfoundland and Labrador. Our website is up there, www.grenfell.mun.ca/arc, as well as our email address, arcnl@grenfell.mun.ca. So you can actually reach out to us to ask to be a community member. It's free of charge, and we'll send you emails. We don't send out that many, but we'll keep you up to date if any of our members are doing talks. We also have a participant pool, a directory of potential research participants. So if you're interested in participating in research and you're not sure how to do that, reach out again, just send us an email and we can fill you in on our participant pool. And that way, if any of our researchers are looking for folks to participate in research, they can contact you directly and fill you in on those things. Okay. Thanks so much. Oh, and I should stop sharing now. And Andrea, I got to pass it back to you, do I? Or can you take it back?
I can take it back. Got the power. Thank you, Veronica, so much. Just going to flip between my slides here now. Okay. I think, here we go. I've got the power. So a huge thank you, Dr. Hutchings. That was a very informative presentation. I'd like to also thank our sponsor for today, MUNalum. If you need new or supplemental life, health, or dental insurance, this recently added program for alumni and members of the Memorial community is something that you should check out. So now we will move into, oh, I'm at the end, hold on now. Questions. There we go. We have a lot of questions. We have a lot of comments and really positive feedback from a lot of people, and a lot of people saying thank you, Dr. Hutchings. So I am going to try to move through as many as I can and just kind of go in the order that I have received them. I'm trying to group themes a little bit so that we can kind of we can hopefully get to all of the questions. Somebody had commented though, Dr. Hutchings, are you aware of dementia ability? And have you used it? So I Googled it while you were speaking, and it's a website, dementiability.com. Are you aware of this website or have you used it?
I am not actually.
Okay. Okay.
So I can certainly check it out later though. And if that
Send
person
you the
wants
link.
to email me, if that person would like to email Acknowledgement, and I can certainly have a look at that and let you know. Yeah.
Excellent. So there's a few people have kind of posted kind of examples of, something that might happen or something that they've experienced. And somebody had posted about their mother-in-law who calls during the night at all hours and will call until somebody answers the phone. So what can they do to stop this? And sometimes it's kind of, in the middle of the night, 1 a.m., 4 a.m., 5 a.m. So any
Yeah.
tips or suggestions on how to deal with a behavior like that?
Yeah, that's really challenging, right? And so I guess one of the things in terms of my mind is, wondering, what's the reasoning for that? Is there an unmet need that's happening, or is it just that their sleep is being disrupted? Maybe they're lonely, maybe that's the need. So if so, can you put in whether it's uh, you know, and I don't know if the person, I'm assuming they're living alone if they're getting up and calling you, but maybe not, right? Um, Again, it also will really depend on the person's level of insight, right? And so that's one of the things. For example, individuals with more frontal temporal dementias. So again, the dementias that really affect the frontal part of the brain, but not necessarily their memory, the can be really difficult for them to understand that they're not making the best decisions, right? So like, calling their loved ones at 3 a.m. when it's not an emergency, not the best decision. So, is if the person does have awareness, like, oh my God, I didn't realize what time it is. Sometimes it can just be, as simple as putting a note by the phone in terms of, check the time. Do you know what I mean? Before you call, right? Sometimes it's, if it's, if they're asking questions, um, other times it's just, it can be really difficult, right? So what can you do, right? So, and I know lots of times people, they don't want to put their phone on do not disturb when they're going to bed because of, well, what if there really is an emergency, right? And that can be challenging, right? Are there other people that you can, you can tag team? Do you know what I mean? In terms of taking turns, because if your mother-in-law is, in those later stages, maybe there's some other siblings or there's some friends. And so maybe you can say, tonight, call this number. Do you know what I mean? In terms of directing, right? And so that at least is not the same person who's getting woken up all the time in terms of helping to share that load. The other thing is, talk with their physician. If you're able to go with, right, and just mention, because maybe she's not talking about that the sleep is waking her up. Maybe it's pain. And maybe there's really bad arthritis and the pain is waking them up at night and it's not well managed, and they wake up and they're pain and they're lonely, so they call you. But if their pain was better managed, then maybe they might actually sleep through the night. So it will really all depend on what's waking them up. So, kind of if you can have a conversation, depending on their level and their ability to communicate that either with them and or with their physician as well, you can kind of problem solve and brainstorm some ideas. But those would be my first thoughts about where to go with that.
Thank you. There's a few questions, and I know you alluded to this earlier. A couple of people have asked, how is dementia diagnosed? Is it through a GP or another healthcare professional? Um, and again, sort of, what is the common process being diagnosed? So I know you had said earlier there wasn't a blood test, really
Yeah,
it's,
it's
sort of an
it's
exclusion.
it's a diagnosis of exclusion. So yeah, so you will get blood work done because if you have, for example, thyroid disease that's unmanaged, right, that will mimic the symptoms, that can mimic symptoms of depression, right? If you have a urinary tract infection, for example, in seniors, then you can develop it's not uncommon that they would develop a delirium, which can look similar to a dementia, but once the infection is treated, then it's resolved. Right? And so, sometimes people say, well, delirium, it's a reversible dementia. Oh, it's not really a dementia, but I can understand why people might think that, because it's like, oh yeah, they just gave me these antibiotics and it cured my dementia. It wasn't a dementia. You had an infection, and as a result had some confusion because of it, which is not uncommon as when you get older. So in terms of ruling out, making sure, is there any vitamin deficiencies, right? Is there, was there a specific incident? So was there you might get a CT or an MRI to see if there was a specific stroke, or if there is a tumor or some other cyst or mass, something else that could be causing this. So basically, in the case of a typical Alzheimer's disease, quite often it might be your family doctor that can make it, because if it's following all the typical things, because we know a fair bit about that in terms of, it's relatively common. If it's something that's a little bit more tricky, like, well, I'm not quite sure what this is, you may need to see a specialist. So it could be a neurologist, it
Okay.
could be a geriatrician. You might actually be referred to someone similar to me, who's called a neuropsychologist. So this is a person who would actually give you a bunch of paper and pencil tests, and that would assess how your brain functions. So like a CT or an MRI takes a picture of what your brain looks like in terms of the structure. A neuropsychological assessment is a test that sees what your brain can actually do in terms of how it's functioning. And then so we can see, okay, is it actually a memory problem or is it an attention problem? Because if you have an attention problem, right, you're not able to pay attention, you're not going to remember anything, because nothing got in there to begin with, right? You need to
Yes.
be able to attend to an information for it to get into your brain, for you to be able to remember it and pull it out later on, right? So there are these specialized paper and pencil tests that can, and sometimes they're done on computers, some of them as well, that can help with that. So, it will really depend on your specific symptoms. If it's following, kind of a classic example, if you have a bunch of cardiovascular risk factors, for example, it may be pretty obvious that it's, either a vascular dementia or a mixed vascular and Alzheimer's, and you might not need a bunch of these other things. It might just be that history, taking that really good history along with, a few other tests to exclude things, right?
Thank you. Next question. So I've noticed a change with respect to remembering some things, and I'm in my late 40s. So what is the specific age range that you're referring to when you talk about a typical age-related changes? So those things you were talking about earlier, the normal, although I loved your comment about normal being a setting on a dryer.
Well,
So
it is, right?
exactly.
Um, so when we're talking about, so on average, we see, age-related changes start to happen in, around the 50s or 60s. That doesn't mean that you're not going to see changes earlier, right? So particularly, so this person, they said they're in their 40s or
40s,
late 40s.
late 40s.
So late 40s. So you're in your late 40s. So, depending on what's going on with your job, you may have children, you may have aging parents that you're dealing with. And, there's this little thing called COVID-19. I don't know if you've heard of it, that we're all kind of going through right now. So when you think about that, when we add additional stressors, when we add additional demands, it makes it harder to remember, right? I know myself, I have two school-age children, and I got to admit, I am dropping more balls these days than I was, say, 2 years ago, right? And that's, because I'm, juggling the homeschooling thing plus trying to work remotely, and the guidelines. It seems like they're changing every day, and that's not a criticism of the guidelines or whatnot. They're very important, but it's just it's the reality. This is the reality that we're living in, right? So when you think about it, just kind of step back and say, well, what's going on with your life, right? That said, if you're concerned, by all means, go talk to your doctor about that, because there may be other things. So, for example, I know thyroid disease often comes out in the 40s, can be first diagnosed. So, particularly if there's a family history of thyroid disease, go and just get some, that generic blood work, but that basic blood work, blood panel, and just say, I'm noticing these symptoms, and just, thought I'd run it by you to see if, and see what your doctor says. And that would be my recommendation, right? Now, it very well could just be completely understandable and a very appropriate reaction for everything that's happening in your life right now, depending on what's going on. Um, we also know, symptoms of anxiety, anxiety and depression, and when I say anxiety and depression, I'm talking about, the mental illness, not necessarily feeling sad and anxious, which are also totally valid and completely appropriate experiences right now. They can affect our ability to think and remember, right? And particularly, the older you get, the more closely depression, the mental illness, looks like dementia in seniors. So when I say seniors here, I'm talking about 65 plus, right? So, but again, you can experience cognitive challenges because of a mental illness as well. So if you find that, you're really down and you're blah, 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 go have a chat with your physician, right? And just to talk about that, because sometimes it's just about recognizing and understanding, and that can help you. Like, okay, it doesn't necessarily mean that you need doesn't necessarily mean that you need, antidepressants or medication or anything, but like, let's go and have the conversation.
Excellent. A few people have commented about best ways or tips to support family members. And I think related to that, there's a few people that have commented about loved ones being in denial of their diagnosis. So if somebody, if other people notice things or they have been diagnosed, but, they're sort of not admitting. So any suggestions there for tips on how to help your loved ones or your family members deal with it?
Okay, so they're kind of two very separate things, right? So the great thing about helping support loved ones, so the family and friends of persons living with dementia, there are a bunch of resources, right? And if you haven't already, connect with the Alzheimer's Society of Newfoundland and Labrador. I have to put out a big plug to the Alzheimer's Society, because they are such a huge, wonderful resource. They When I was working in Nova Scotia with the Alzheimer's Society of Nova Scotia, we actually brought in Shaping the Journey, which is a 6-week psychoeducational program for persons in the early stages of dementia, as well as their care partners. And if you go to their website, you can actually download a copy of the manual that we used for that group for free. And a lot of these tips and stuff that I was talking about, as well as a bunch more information, is available there. So go check out their website, the Alzheimer's Society. Um,
Somebody had mentioned a dementia passport program on Alzheimer's Society's website.
Yeah,
Okay.
fabulous. Yeah, absolutely. In terms of kind of connecting with them, because, and a lot of times people think, well, it's not all, I've been diagnosed with frontal temporal, or been diagnosed with vascular. The Alzheimer's Society, they support individuals with all types of dementia, not just Alzheimer's disease. It's just that Alzheimer's disease happens to be the most common one.
Right.
So in terms of supporting friends and family members, being there, what do they need? I think asking them is easy, right? Because maybe that person needs help with laundry. Maybe that person needs help with, a cooked meal. Maybe they need a night off, so that, you know what, hey, why don't you give your mom my number and she can call me tonight at 3 a.m. instead of calling you, so you can actually sleep through the night. If you have that type of relationship, right? So it really, it's going to depend on the individual person in terms of what they need. Just giving them a space, to let them talk, to let them vent, right? As opposed to, and really validating their experience. I think it can be really easy to say, oh, it's not that bad, or, oh, you can do this, or, it's going to get better. It's a neurodegenerative condition. The symptoms are going to get worse, right? And that's a fact of life. And eventually the person will die. Same way I'm going to die, and the same way you're going to die, and we're all going to die. Life is terminal condition. And so, I think that the more we can kind of get comfortable with that and talking about that, the easier that is. So often people really shy away from emotions. And I think as a society, once upon a time we didn't talk about emotions at all, and we didn't talk about mental illness at all. And now we've kind of swung the other way. We're talking about them more. We have a long ways to go. But now, whenever somebody says that they're sad or they're worried or what, we think, oh, you have depression, oh, you have anxiety, the mental illness, right? You need to go see a physician. You need to go get medication. You need treatment. You need to see a psychologist. You need to talk to somebody. Well, you probably do need to talk to somebody, but it's probably not me, right? You need to talk to a friend, a family member, somebody who loves you, right? Someone who's going to say, well, yeah, of course you're crying. Your mother, who took care of you, is now calling you at 3 o'clock in the morning and asking where her slippers are or whatever it is that's happening. So if that's, going on, let them talk, let them cry, right? Say, you know what? Yeah, if I was in that position, I'd probably be feeling some of those things too, right? And encourage them to reach out to their physician, right? Because again, it's really easy for family members and friends, particularly if you're the primary care partner. And I say care partner, right? Because it is a partnership between the person living with dementia and the family member or friends, right? So it's really easy for that care partner to let go of themselves. So if you notice they're not eating, if you notice they're not sleeping, if you notice they're not taking care of themselves, say, hey, I'm concerned about you. You need to take care of yourself too, because you can't pour from an empty cup. I know that's a cheesy platitude, but it's
But
true,
it's true. Exactly. Yeah.
right? And so that's for the family members and the friends. In terms of the person, how do you support, somebody who is, in denial, or, I would say, doesn't have, is lacking insight around the diagnosis? It will really depend, is it a true lack of insight? Because sometimes what happens, you get that diagnosis and you're in shock. And myself and other psychologist colleagues, we say, a little bit of denial is not necessarily a bad thing, because sometimes, no, it's not happening, and you need that week or two and just to kind of come to terms and accept it, and then you can deal with it and move on, right? And so sometimes you need that, and that's not necessarily a bad thing. So, have you just been told the diagnosis and they're like, nope, this isn't happening? If so, I wouldn't be too concerned. I just give it some time. Do you know what I mean? Because again, it's still really fresh. If, however, it's actually a symptom, because again, with that frontal lobes, that judgment, if that is part of the symptom, um, that is much more challenging, right? And so if you're trying to, how do I get mom to understand or dad to understand? You're not. Their brain, the frontal lobes aren't working. So, it's in, if you think about trying to rationalize, likewise when a child whose frontal lobes aren't fully developed yet, they want the orange cup, so you give them the orange cup, but they wanted the blue cup, and you're like, I don't understand, and it's because their frontal lobes aren't developed yet. Well, in this case, if the frontal lobes, are being affected, you can't rationalize that. So, and you can't, try to make them understand if they're not able to. So, and if you're not sure, okay, are they just being difficult, or or is this an actual symptom? My personal recommendation, if you're going through, assume it's a symptom, because it's going to be a lot easier for you. Ultimately, it doesn't matter, um,
Right.
but it's for your own mental health and wellness to say, okay, this is the disease that's making, mom, dad not get this
Right.
and not understand this. And then from there, so what can you do around that then? So can you, distract, right? So you say, well, we need to talk about future planning, right? And we're like, well, then, you bring it up and say, well, you know what? I was talking with my lawyer and they said, oh yeah, I need to get all this stuff done up. So we should go to your lawyer now and let's have, right? So don't make it about the dementia then, distract.
Right.
Either is there another way that you can talk to them? Is there another way you can bring this up? And maybe it's not you. Do you know what I mean? Can you pull in some other people, right? And sometimes it might be, in this case, talking with your physician about bringing in another physician to play the bad guy,
Right.
right? So if you have a really good relationship with your family, or the person with dementia has a great experience or a great relationship with their primary healthcare provider, but some things need to change, And this is typically more happens, I'm talking more moderate to late stage, not the early stages. But it's good to kind of think about these things. So, and if you're someone who's here and you're in the early stages and you're listening to this, so, how do you want your family members to deal with that when you're having trouble making some of the things? Have those conversations, bring them up. And if you're living with dementia and that's hard for you, blame me. Say, I saw this talk and Dr. Veronica said that I should bring this up to you. I'm happy to take the blame to start any hard conversations,
Right.
right? And,
Yeah.
and have those things, yeah, talk about it. Oh,
Wonderful. We
does that
have
answer the question?
so many more. It does, and we have so many more questions, but we can't get through all of them. Lots of
Oh,
positive comments again, and people have asked if the slides will be available and the recording, and we will send that out via an email. So I hate to clue it up. A huge, sincere thank you to you, Dr. Hutchings, for sharing your expertise with us. I'll just ask you if you have any final words before we do clue up.
no, just if you're going to get this email, if anyone is, listening and you missed something, by all means, watch the recording again. Reach out to your Alzheimer's Society, reach out to your family doctor. I know if you have one, I know it can be hard. But again, I think it's that communication, right? The more people that you can get in that team helping you, the easier that this journey is going to be.
And actually, somebody had mentioned, I'll just bring this up quickly before we clue up, that there's a public session online this evening about wills and powers of attorney and health directives with the AC Hunter Library. So if you follow them on social
Fantastic.
media, you'll be able to see that, and that's a free session by one of the public libraries.
Thank you for sharing that, whoever did.
Yes, yes. Okay, we are going to wrap up. Thank you, everybody, again for attending. Thank you for all your great questions. If you enjoyed today's event, please check out our alumni website for more upcoming events. As you can see here on February 8th, our next will be Combating Climate Change in Action. And on February 15th will be Fake News and Misinformation, Understanding and Navigating this Challenging Landscape. So both very timely topics. So again, as I indicated earlier, the session has been recorded. You will receive this via email. So we hope you enjoy the rest of your day, and thank you again. Bye.
Goodbye. Thanks.